हेलो एंड नमस्कार सभी को। गुड इवनिंग, गुड मॉर्निंग टू ऑल। आप हमें जहां से भी सुन रहे हैं, मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेज लाइव सेशन। आर यू स्ट्रगलिंग विद डे टाइम स्लीपीनेस? Let e-global doctors help you wake up refreshed. Your solution to a more energized day is just a click away. So viewers, we are live on Facebook, Instagram, Twitter, LinkedIn, YouTube. You can join us through your favorite platform and you can comment down in the comment box for any doubts. So today we are going to discuss about the narcolepsy, which is excessive daytime sleepiness. So let's get started. So for today's session, we have our expert, Dr. Anup Katyal. Dr. Anup Katyal is one of the most prominent doctor who has an experience of more than 30 years. He is board certified in internal medicine, critical care, neurocritical care, and sleep medicine. So, Dr. Anup, sir, how are you doing today?
I'm doing good. Thank you so much.
Yeah. So, sir, as we are going to discuss about the narcolepsy, so should we dive into the session?
Sure.
Yeah. So for today's session, my first question is like, what are the common causes of excessive daytime sleepiness?
So this is a very common symptom, and when we see a patient in sleep medicine or in internal medicine, and someone complains of being excessively sleepy, we look at about 6 or 7 common reasons. One of the most common is insufficient sleep. So people are not spending enough time in bed. They're spending 4 or 5 hours, and just because of the pace of life, that's a very important cause. More so in children and adults uh, alike. In addition, in this day and age, because of a lot of obesity, we see sleep apnea is a very important cause, namely obstructive sleep apnea. Sometimes we see people who have what we describe in common terms as restless leg syndrome, and then at night when they sleep, they have leg movements, which we call as periodic limb movement disorder. Then there is a condition called narcolepsy, which we will discuss in detail. Sometimes we have to look at mood disorders like underlying depression that may be severe enough that can cause one to be sleepy. One can never ignore medications. You have to go through the medicine list. And there are a number of medicines with side effects causing sleepiness that cannot be discounted. And last but not the least, if you have excluded all other reasons and you've not come up with a cause for excessive sleepiness, then we say you have what we describe in medical terms as idiopathic hypersomnia, that you're sleepy, but we don't know the cause for it.
Okay. So, sir, as you shared the causes, so what are the common symptoms of narcolepsy and how they impact in our daily life?
So, narcolepsy is a condition where actually you have excessive daytime sleepiness. Eh, Traditionally, when we say someone has narcolepsy, we look at 5 different symptoms. One is you're excessively sleepy. Second, people describe something called cataplexy, which is a condition where, with extremes of emotions, you have your muscles giving way, and they can last for a few seconds to a minute, and in extreme cases, may last up to 30 minutes. You don't lose your consciousness, though. The third condition that we look for is sleep paralysis. And what that means is that you wake up from sleep, you want to get up and move, but you cannot move because you feel paralyzed. And this is not only seen in narcolepsy, it can be seen in other situations too, but that's one of the features of narcolepsy. Another thing is what we say is people who have narcolepsy have very poor sleep, and as they are falling asleep or when they wake up, they may hallucinate, that is, hear or see things. Usually, visual hallucinations are more common. We say hypnagogic, that is, when you're falling asleep, or hypnopompic, when you're waking up. And the fifth thing, which constitutes the pentad for narcolepsy, is the sleep is very disruptive. So they don't sleep well. So those are the 5 things in the appropriate setting we look for in patients we suspect who may have narcolepsy.
Thank you, Dr. Anu, for sharing the causes. So as we discussed the like symptoms and causes, so moving to our another question. So are there any different types of narcolepsy and how do their symptoms vary?
So, as I said, narcolepsy is divided into two types, type 1 and type 2. In type 1, we say you have narcolepsy with cataplexy, the hallmark of which I just explained. And type 2 narcolepsy is, you have narcolepsy without cataplexy. So, those are the two different types of narcolepsies we describe.
Okay. So, so how is narcolepsy is diagnosed and like what kind of medical professionals can help?
So, uh, one of the main problems with the diagnosis of narcolepsy is a lot of times, we say if mind does not know, eyes never see. So someone comes in with excessive sleepiness, and we say, oh, there is some psychiatric problem. There are some other issues. You're not sleeping well. You're taking too much of caffeine, and the diagnosis of narcolepsy is not entertained. And on an average, it may take 5 to 10 years before sometimes the diagnosis is made. So if you have to have an astute internal medicine physician or a sleep medicine doctor who can then make the diagnosis. So, in order to make the diagnosis, again, as I said, the type 1 narcolepsy is narcolepsy with cataplexy. Obviously, you have to ask the relevant, symptoms. And if you strongly suspect, then we do something called an overnight sleep study. And the purpose of the sleep study is to exclude anything else. That is, you don't have sleep apnea, you don't have leg movements. And we also have to document that the 2 weeks preceding the sleep study, that you're getting enough sleep, that is at least 6 hours of sleep. We have to make sure you're not taking any medications that work on the brain. Because a lot of times people are on certain medications like antidepressants, which can suppress your REM sleep. And this is one of the things that we look for. So after doing an overnight study in the morning, we do a urine drug screen to make sure there are no drugs on board. And then we, 2 hours after waking up, have the patients take naps. We have them take multiple naps at 2 hour intervals. And basically, what we do is we try to see how quickly you fall asleep and whether you go into a state of sleep called REM sleep. So these are 20-minute naps. We have 5 of them during the daytime. And essentially, if 2 out of 5 naps you go into REM sleep, or the preceding night when you fell asleep, you went quickly into REM sleep, and your sleep latency, that is how quickly you fall asleep, is less than 8 minutes, that clinches the diagnosis in the appropriate clinical setting that you have narcolepsy. I will also point out that sometimes when you suspect, this history is very clear cut. You are excessively sleepy, you have cataplexy, you are having hallucinations, you have sleep paralysis, you have disruptive sleep. These are all the hallmarks. But for whatever reason, you're on medications that your other doctor, psychiatrist says you cannot get off, then, people who have type 1 narcolepsy or narcolepsy with cataplexy, you can do something called as a lumbar puncture, that is, drain some fluid from your spine, and we check something called hypocretin. So essentially, narcolepsy, hypocretin is a wake promoting neuropeptide produced by our hypothalamus, and you're deficient in that. So if you can do a lumbar puncture and check for hypocretin levels, then also you can clinch the diagnosis of narcolepsy type 1.
Yeah. Thank you, Dr. Anup sir, for sharing how narcolepsy is diagnosed and like how medical professionals can help us. So, before hopping to our next question, viewers, eGlobal Doctors is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. So, viewers, we are discussing about narcolepsy, excessive daytime sleepiness with our expert Dr. Anup Katyal. So you can ask your doubts in the comment section. So let's back to our next question. So, Dr. Anup, as we discussed about the causes, symptoms, and different types of narcolepsy, so can lifestyle changes such as sleep, hygiene, and diet play a role in managing narcolepsy symptoms?
So definitely, when someone has narcolepsy, one of the hallmarks of people who have narcolepsy is they want to take very short naps. So these naps lasting 15 to 30 minutes. And these naps in people who have narcolepsy are very refreshing. So certainly, what we can suggest in lifestyle, or, if you're working someplace, the employer needs to be aware that you carry a diagnosis and that provision has to be made. that you should be allowed to take naps. Again, as I said, narcolepsy is a condition that usually you see in patients between age 15 and 30, around 20 years, and then there's a second peak around age 40. But there is no age that is immune. So depending upon which stage of life you're in, for example, if you're an adolescent, then you're going to school, college, then that is very important that that diagnosis be shared, so that you are allowed to take short naps 2 to 3 times a day, because those naps would be very refreshing and would be very helpful.
So, Dr. Anup Katyal, what are the available treatment options for narcolepsy and how effective are they?
So as far as treatment options are concerned, once the diagnosis is made, again, as I said, there are two main things. One is excessive daytime sleepiness and one is cataplexy. So there are certain medications that we call as stimulants, for medications like modafinil or an isomer of modafinil that works on the dopamine system. You take 100 to 400 milligrams in the morning, that keeps you awake. In children, we can use something called amphetamines. So they are very helpful in keeping one awake. On the other hand, if you have narcolepsy with cataplexy, there are a couple of drugs that target both. And the two drugs that are very effective in treating both is, one is called sodium oxybate. It's a compound that you take actually at night, because I said people who have narcolepsy have very poor sleep. So it improves your sleep. And there's another new drug recently approved by FDA called pitolisant, which works on H3 receptors. And these work both on excessive daytime sleepiness as well as cataplexy. On the other hand, you can use medications in isolation. For example, as I said, you can use stimulant to keep you awake for the excessive daytime sleepiness, and you can use another medication to treat cataplexy. And the two most common medications that we use, one is called fluoxetine, which is marketed as Prozac here, or another drug called venlafaxine or Effexor. Those are two drugs very effective for cataplexy. So you can either mix or match, or if you want to use a single drug, then either you can use sodium oxybate, which I should point out is in general, approved for children above 7. And then there's another drug called pitolisant. So these are the two drugs that work on both excessive daytime sleepiness as well as cataplexy.
Okay, so moving to our next question. So, Dr. Anup, how does narcolepsy affect our mental health, and what are the coping strategies can individual use?
So again, people who have narcolepsy, again, as I said, it's not just a condition where you are only sleepy or tired during the daytime. Even your sleep at night is not good. So obviously the environment, sleep hygiene issues that are relevant for anyone would also be applicable to people who have, narcolepsy. Obviously taking too much of caffeine close to bedtime, 8 to 10 hours, doing very strenuous exercises close to bedtime, all those things should be avoided. And again, as I said, depending upon the age at which this condition is diagnosed, strategic naps during the daytime are very helpful in managing it. People who have narcolepsy are also prone to have other sleep disorders like restless leg syndrome, obstructive sleep apnea. So we should be on the lookout for those as well.
Okay, so Dr. Anup, are there any advancements in research or new treatments for narcolepsy that people should be aware of?
So I will go back just one step. When you asked me what are the causes or what are the precipitating factors, I should have mentioned that at this point we think there is a genetic component to it, and we see it with a certain HLA. And as far as narcolepsy type 1 is concerned, there's something called HLA-DQB10602. It's a lengthy name, but it is positive in majority of the patients with narcolepsy type 1. But the problem is that it is also prevalent in about 40% of the general population, which does not have narcolepsy. So if you're suspecting that this patient has type 1 narcolepsy, he or she has all the features of narcolepsy, then if you do HLA-DQB10602 and it comes back negative, you essentially rule out this patient has type 1 narcolepsy. And I will point out that narcolepsy is seen equal in both sexes, male and females. it's equally prevalent. And to answer your question, there are two or three different etiologies for narcolepsy or precipitating factors. One, as I said, the genetic component. The other they're thinking about is an autoimmune component, just like type 1 diabetes. It's an autoimmune condition. They think that narcolepsy could also be an autoimmune condition. There are certain things that we saw in 2009, H1N1, influenza precipitated narcolepsy, sometimes stress. And I should point out, again, going back, when I mentioned cataplexy, it is a condition that is always exacerbated whenever there is any change in emotion. Either you're very happy or very sad. That's what precipitates this. So people are targeting both the genetic component as well as the autoimmune component. So towards this end, in addition to the medications I mentioned, people are looking at, IVIG, that is intravenous immunoglobulin to target. They are also thinking that there may be T cells that may be, migrating towards the brain that could be causing destruction of hypocretin or orexin, the neuropeptide, which is the wake-promoting peptide. So people have looked at certain monoclonal antibodies, and the best would be, you're deficient in hypocretin. So can we produce synthetic hypocretin, which can replace this wake-promoting neuropeptide? So those are some of the things in which the research is going, looking at IVIG, looking at monoclonal antibodies, and synthetic hypocretin or orexin.
Okay. So thank you, sir, for sharing the advancements and new treatments for narcolepsy with our viewers. So moving to our next question, how can our friends, family, and colleagues can support someone with narcolepsy?
So, one of the things is a lot of times when someone is diagnosed, they say, oh, he's lazy, he's not motivated, he's always sleeping. And that myth has to be dispelled. If you have narcolepsy, there's nothing to shy away from it. And you need all the support. It goes without saying. If you have this condition, certain psychological disorders like depression, etc., may also come into play. And so obviously a supportive environment, whether it's from friends, families, goes a long way. In addition, when people who have narcolepsy, even for work situation, the employers have to be cognizant of the fact, and it is better if they don't do shift work. So asking them to work the second or third shift, and these people already have trouble sleeping as it is, so that will just make a bad situation worse.
So, sir, what are the different misconceptions about narcolepsy? Would you like to address and clarify?
Sure. So one of the things is that, the age that, young children, again, are immune from narcolepsy. Again, as I said, you can see it as 5 years, 6 years, and up to 60, 70, 8 years. There's no age that is immune from narcolepsy. The second myth that goes on is that, people who have narcolepsy need to sleep much longer during the night. That's not true. All they need is whatever an adult needs, 7 to 8 hours of sleep. That is what is needed. The third part I mentioned earlier, that someone they are lazy, lack of motivation. That myth needs to be dispelled. Another thing, just like diabetes, there's no cure for it, but we can control the symptoms. Similarly, with narcolepsy, there is at this point no cure for it. And if you have narcolepsy, we can certainly, with medications, control your symptoms effectively. One other myth is that, you have narcolepsy, so you cannot drive. That's not true. If your symptoms are well controlled and your doctor is comfortable, whether, as I said, you're using sodium oxybate or pitolisant, or you're using a stimulant medication along with an SSRI or an SNRI to treat the excessive daytime sleepiness, cataplexy, you should be okay to drive. So those are some of the prevailing myths regarding narcolepsy.
Yeah. So, Dr. Anup, can you provide a summary on some practical take-home message for those audience who just have joined us?
So narcolepsy is a condition that is, it takes sometimes 5 to 10 years to come to the correct diagnosis. People are labeled as having some psychiatric problems, other issues. They get put on antidepressants. No one gets to the, meat of the problem, asking them the relevant questions. So in the appropriate setting, If you ask the questions, you can get, as I said, the pentad early on: excessive sleepiness, cataplexy, you know, sleep paralysis, hypnagogic, hypnopompic hallucinations, and more often than not, they have very disruptive sleep. If you have those kinds of symptoms in the appropriate setting, then you should go ahead, consult a sleep doctor, get an overnight sleep study followed by the MSLT again, as I mentioned, and then that would help you clinch the diagnosis, and we have effective treatments for it. One thing also I would say, these, when I mentioned the etiologies or precipitating factors, whether it is genetic or whether it's autoimmune, there is also an entity called secondary narcolepsy, which when history is being taken, you should take that, because I said this is part of the hypothalamus that produces orexin or hypocretin. So if you've had a traumatic brain injury, if you've had encephalitis, if you have a brain tumor, if you have Parkinson's, if you have multiple sclerosis, that part of the brain may be affected, and you may get what is called a secondary narcolepsy. So one should cast a wide net. There is no age that is immune from this. And once a diagnosis is made, we have very effective treatments to control the symptoms. So a person, just like in diabetes, you can control the symptoms. There's no cure, but they can live a full life.
Yeah, thank you so much, Dr. Anup Katyal. So to wrap up our insightful discussion on daytime sleepiness with Dr. Anup, I encourage our audience to reflect on the multi-facet nature of this issue as we navigate the challenges associated with narcolepsy. So let's be proactive in implementing the practical advice shared today. So thank you, Dr. Anup Katyal, for sharing your expertise and guidance with us.
Thank you so much.
So, viewers, before wrapping up the session, are you looking for second medical opinion for cancer treatment? Well, look no further, because eGlobal Doctors is providing access to top oncologists from across the world. So, thank you so much, Dr. Anup Katyal. It's always a pleasure to have you in our live session. You always bring so much of information.
Most welcome.
So, thank you. Thank you, viewers. So, it's a wrap.